You're listening to The Money Hour with your host, Tina Mitchell, on Alternative Talk, AM 1150. Now, back to the show with local mortgage and finance expert, Tina Mitchell.
Welcome back to The Money Hour with your host and mortgage expert, Tina Mitchell, right here on 1150 AM KKNW, the Saturday, November 19th show, bringing in expert advice and inside knowledge on today's events in our local economy and how they can affect your money. If you're hearing my show at a different time or day, you are listening to a rebroadcast. You can call the show at 1-855-400-1150. Again, that's 1-855-400-1150, or online at themoneyhour.com to discuss anything regarding money with the guests I have in studio today, or anything that you want to chat with your host, myself, about. And in studio right now, having a conversation with Dr. Kabran Chapek with Amen Clinic Northwest. How can investing in brain health improve the health of your finances? Dr. Chapek, thank you so much for joining me back in studio. It's always a different spin. The show is called The Money Hour. It's all about money and how to make more money, save more money, have a better quality of life for my listeners, as well as extending to their family. And so it's just an interesting topic and a spin bringing in. I really appreciate you joining me in studio.
Thanks for having me, Tina.
And a little bit about Dr. Chapek, a licensed naturopathic physician, studied human biology at the University of Kansas, followed by naturopathic medicine at Bastyr University in Kenmore, Washington. With an interest in the mental health care field, he received his clinical psychiatric experience from 2007 to 2013 while treating patients with severe mental illness in the partial hospital program as part of the multidisciplinary team. So, Dr. Chapek, I want to just start out and share with my listeners, how does work at the Amen Clinic, working with patients with different mental health and neurologic conditions, relate to finances and investments?
Mm-hmm. I'm so glad to be here because, brains run the world. Mm-hmm. And when you're thinking about finances, it really comes down to the decisions that you make in the moment. And so you have to have all your mental faculties firing on all cylinders, be able to make a good decision, right? And so if your brain isn't working well, you're going to have a harder time making good decisions in the moment when it really counts, when it really matters.
And that makes total sense when you think about it. It's, everything that we do can be attached to the health of our brain. And obviously things that take such brain thought in such as financings could make a big impact. So let's talk about which part of the brain is involved in financial decision making.
Yeah, so the frontal lobe, right behind your forehead, is the part involved in decision-making, focus, concentration, which we need. You're reading through contracts, you're trying to put all the pieces together. Mm-hmm. And then your temporal lobes, which are right behind your temples, are your memory centers involved in remembering all those facts and information that you've been reading about and thinking about. You have to pull up to make a good decision. So it all really uses your whole brain in summary. And then there's parts of your brain that can get in the way of decision making. So they're part of the brain, kind of the old brain, the reptilian brain that's associated with survival, the limbic system. And if it's fired up, if you're fearful and anxious, it's hard to make good decisions, or you make decisions based on fear, which is not always good in finances because you want to be able to sometimes take risks. And if you're very fearful, you're not going to be able to take risks. You need to take those opportunities when they're in front of you. So reducing fear helps make good decisions.
Makes total sense. And I talk a lot about the adrenaline as well, and understanding the adrenaline that we have and using it to your benefit versus allowing it to take you down. And I would imagine, could be the same thing. So Dr. Chapek, when it's talk about common brain problems, with your top executives that you work with, I have a lot of business owners that listen to the show. And so what are those common brain problems that you're seeing?
I'll say 1 in 4 top executives or managers have some kind of mood disorder, depression, anxiety, or learning disorder like ADD or dyslexia. It's really, really common. Some use it to their advantage, like Richard Branson of Virgin America has dyslexia. Peter Knight from Check Free has ADD. And they were, Richard Knight, he said, I'm either going to start my own company or I won't be able to do anything. I know I can't work for someone else, because these folks, if you have ADD, your frontal lobe is more open. Not able to focus. You can kind of imagine someone in a whirlwind with papers flying, but they've got these brilliant ideas and they're creative problem solvers. And they always have a really good type A executive that keeps them online, keeps them in track and organized. And so they've figured out ways to make it work. But many others have a lot of difficulty with depression and anxiety. And a lot of folks in the workforce have these issues and really need help, but may not realize it.
And I want to go back to what you first said, because another thing I always talk about is embracing your strengths and hiring out your weaknesses. So if you've got a challenge with your health and things that are there, finding out the best qualities that you have and being able to shine. And just with the people that you mentioned, look what they've been able to accomplish, even though they have some challenges in those areas.
Exactly.
So with the growing number of people with Alzheimer's, isn't it better to just wait until you can't remember your own name, and so you don't have to live in fear?
This is a hot topic, and I'm really excited to talk with you about it. Since I was on last year, there's been a lot of development, and we've figured out a lot about Alzheimer's. And I mean, if we just think about financial, right now, there's 5.3 million Americans with Alzheimer's disease. By 2050, that number is going to triple. That's going to bankrupt Medicare, first of all. It's this third leading cause of death behind heart disease and cancer now. And so it's growing, and currently there's no treatment. There's even no way to prevent it, according to the current conventional literature and scientists and doctors. However, a neurologist out of UCLA who's just been in the lab for 27 years trying to research and figure out cures for Alzheimer's and dementia. He has come upon a program that he's been able to show reverses cognitive decline and reverses memory problems in folks who are headed towards Alzheimer's in 9 out of 10 patients that he did this small study for. 6 had to quit working, and they were able to go back to work.
Wow.
And so we've teamed up with him as part of the Amen clinics. We use SPECT imaging to assess the brain, and then use these types of functional protocols to help improve folks with Alzheimer's, and especially early on. If there's signs of memory problems, that's when you want to address it and tackle it.
Yeah, and everything else, when I talk with experts in all arenas when it comes towards with money, estate planning, your CPA, and everything that you do, procrastination is something common when it comes to finances. And I think procrastination comes with anything that can be a fearful thing, or something that you're trying to avoid or pretend that it's not there. And I would imagine that when it comes to things with our brain and keeping it healthy, not procrastinating, doing exercises and things that can help strengthen that would be a high benefit.
The more proactive you can be, the better. Especially with Alzheimer's, the earlier you do something, then we can turn that ship. It's like a Titanic that's going. You can do things like exercise, diet, nutrition. You get a lot of mileage out of those lifestyle changes before you have to go to psychiatric medications and things that sometimes even aren't that helpful in Alzheimer's disease.
Yeah. So what sort of financial investment is there in the early diagnosis of Alzheimer's?
The Genworth Financial Survey shows that you can save about $1 million over 10 years. Now, that's based on the cost of care in assisted living. So if you have a late diagnosis, you're going to pay more. So it's about $500,000 if you get an earlier diagnosis with assisted care. But I would like to see, folks get assessed way before that. With SPECT imaging, you can detect changes 5 to 9 years before symptoms even begin to occur. So you start having memory problems. That's a concern you want to check out with your doctor.
Yes.
You want to get it assessed.
So what can you do to protect your brain as you age, ultimately, hopefully protecting from Alzheimer's?
Yeah. What we've seen is the things that we know we should be doing. We should be exercising, getting 7.5 to 8 hours of sleep every night, checking your important numbers, especially blood sugar. Type 3 diabetes is what it's called, is insulin resistance in the brain. And so checking that and controlling that, sometimes doing like intermittent fasting, where you stop eating after 7, you don't eat till 7 a.m. the next morning. It's not like fasting for days, it's just throughout the night, 12 hours with no food, resets the insulin receptors. Doing things like brain games. So, we think about exercise for the body. You want to exercise the brain as well. It doesn't have to be Lumosity, or My Brain Fit Life is another good one. You can play cards. You can challenge yourself, try to remember that grocery list and hold things in mind. And I think this is something that eventually we're all going to be into is brain exercise.
So kind of like you talked about fitness. I mean, we all know that we need to work out to stay fit. We're watching what we're eating to keep healthy. Same thing with our brain. So if I'm hearing you correctly, I mean, hopefully it'll be more common that anybody that even might not think that they're at risk of Alzheimer or some type of brain issue in just having a healthy brain, which is ultimately going to help you be smarter, which is going to help us in everything we do with our finances.
Oh, yes.
Yes. So, Dr. Chapek, what can you do if you suspect that one of your loved ones has some memory problems?
You want to tell them that there's hope, that we don't want to ignore that. We want to address it, and it may be something that we can improve. And so you want to, have them come to the Amen clinics for assessment or see their local doctor. And they can do an in-office examination, a brief test, mini mental status exam. There's the MOCA. There's all these different tests that can be done, and it can detect early signs, and then know that there are things that they can do. Okay. And
what is your website at Amen Clinic? What's the best way to reach out to you?
www.amenclinic.com, and we're at Amen Clinics Northwest in Bellevue.
Okay. So if you're listening to the show right now, you can always go to the Money Hour site as well to get connected with Dr. Chapek and the Amen Clinic. But just going in and getting finding out where you're at and things that you can do to train your brain and to get it to maximize what it can do for us.
Yes.
So what are some simple ways that you can improve memory and keep sharp in your age? I mean, I know for myself memorizing names sometimes can be challenging. And I know that there's exercises and things that I should be doing as well. So what are some of those simple techniques that you can share?
I'd say that being sure to keep your stress levels low and exercise. And the way to do that is exercise. You flush out those stress hormones. You make sure your blood sugar is balanced by having protein at each meal and having healthy fats at each meal, avocados, coconut oil, things like this. So if you have a healthy physiology, you're set up to have a better memory and better focus. That's especially true for focus. And then there are supplements that can be taken, actually, that can help with memory. One is called phosphatidylserine. It's a mouthful.
I was going to say that's a mouthful. I won't repeat it.
PS for short. And it's part of cell membranes, and it has been shown to help with memory in several studies at 300 milligrams. So there are a number of supplements. Fish oil, very helpful for focus, for mood.
I've heard that.
Decreases brain inflammation. So the work of Dr. Del Bredesen has shown that what you need to do is look at all of these factors and put them together. So it's not just one thing, but all of the research that's been done, if we put all of these pieces together, that's where we see improvement for brain function, for ADD, for depression, for Alzheimer's.
So I've got a minute, and I've got to take us to a break. A call to action for anybody that's listening to the show right now. What should they be doing?
You can change your brain. You can make it better today. You don't have to wait. And so I would encourage you to pick up the phone, call us for help, or just put on those running shoes and get out and exercise and start doing something for the health of your brain, because you'll be happier, wiser, your relationships will be better, and you'll have better success in work and school.
Dr. Chapek, thank you so much for coming back in studio, and look forward to having you back again soon.
It's my pleasure to be here.
And this is your host and mortgage expert, Tina Mitchell, signing off for the day. Enjoy your Thanksgiving with your family next week, and I'll be here to talk with you next Saturday right here on 1150 AM KKNW.